This is my female Foley insertion video. So the first thing I'm going to do is go over the nursing care plan and make sure that there's an order for a Foley to be inserted. And after that, I'm going to go ahead, identify the patient, verify their name and date of birth, and put on any PPE, if indicated, hand hygiene, all of that. And then I'm also going to double check with my patient to see if they have any allergies to hydrogen peroxide or iodine. My patient did inform me that they are allergic to iodine, so we're going to be using the hydrogen peroxide when we clean them before the procedure. So next I'm going to raise my patient to a good working level. And then also we're gonna, I do have adequate lighting. If I didn't, I would need some artificial lighting to help me with the process. So we're gonna lower this, and then I'm gonna put on a clean pair of gloves, and we are gonna clean the perineal area. So I'm gonna inform the patient that I am going to expose them, and I'm going to let them know what I am doing. And I am going to just to help my patient into the dorsal recumbent position with her knees flexed outward. All right, and then we're going to put a waterproof pad underneath. All right, then we do have some soap and water in here, and we're going to go ahead and clean the area. We're going to use a different corner of the rag on each part. We're going to go from the top to the bottom. All right, and then we are going to dry her off. Get rid of this. Get rid of the old gloves. Perform hand hygiene again, and then get ready to insert the Foley. So we're going to open this up. I'm going to use this for my garbage. I'm going to put on my sterile gloves. Make sure it's not expired. All right, so now we're gonna start setting this up. So we're gonna take this like this and fold it in, just so we don't contaminate that. And we're gonna get it as close as possible. We're gonna take the blue one and lay that right here. And then I'm not going to use this one, so I'm going to put this to the side. And next, we're going to take this out and set this here. And then we're going to start getting set up. So I'm going to take this off, throw that away. So we are using the hydrogen peroxide, so I'm going to get rid of that. So we're going to pour this all over the cotton balls. We're going to open the lubricating jelly, put that right here. And then we're going to take this and we're going to lubricate 1 to 2 inches on the end of that. We're going to have that sit there. So then I'm going to take this hand and spread open the labia. I'm going to take the cotton balls, one down, garbage, garbage, and then one down the middle, garbage. So I don't need those. I'm going to tell her to take a deep breath, and I'm going to let her know that I am going to insert it. So I'm going to keep inserting until I see the urine flowing out, which I do. And I should have opened this earlier just to help me, but I didn't. So we're going to connect this. And then we are going to inflate the balloon. And then now that I've inflated the balloon, we're gonna tug just to make sure it's in the correct place. And it is. So now we're gonna get rid of all of this. We are gonna get a leg strap and strap it to the patient's leg. Then we're gonna hook this down low. Hook it down here. I'm not sure if there's a leg strap in here. We have this. So I'll put this on the patient. And you're gonna leave that part out and then hook it there. And then now you would obviously clean up all of this. Then for taking it out, you would undo this. Take this off the patient. And then you would take your syringe and you would empty that before you took the Foley out, just to save yourself a mess later. So then you're going to uninflate the balloon. And then you're going to tell the patient to take a deep breath, hold their breath, and then you're just going to pull it out. And then you would obviously help the patient with some perineal care, clean up any mess there is, and then come back later and check to make sure they are urinating.